So in 2024, we had 3 new CPT codes come out for caregiver training services. The CPT codes are 97550, 97551, and 97552. Now, 97550 and 97551 are what I call the individual caregiver training services CPT codes. What those two codes are is when the therapist or assistant is doing caregiver training to one or more caregivers of one patient, of the same patient. Whereby 97552 is you're doing caregiver training to 2 different caregivers of 2 different patients. So for example, you have 2 patients. You have Mark, you have Michelle. Mark has his wife Amy with him. Michelle has her daughter Joy with her. You're doing caregiver training to Amy and Joy, 2 caregivers of 2 different patients. That would be CPT code 97552. That CPT code is untimed, and regardless of how much time you spend doing the caregiver training services to Amy and to Joy, you're going to charge each one of them 1 unit of 97552. Whereby 97550 is the initial 30 minutes you're doing caregiver training to 1 or more caregivers of the same patient, and 97551 is each additional 15 minutes done that day by that discipline, doing caregiver training to 1 or more caregivers of the same patient. Now, all 3 of these codes state in the description without patient present. And I get asked a lot, Rick, what does that mean? It means the patient is not present. Now, whether you want to, bring back COVID and do the 6 feet rule, you want to say 10 feet, 20 feet, just the patient is not there while you're doing caregiver training with the caregiver or caregivers. So again, in the clinic setting, you might be in one part of the gym, the patient is on a treatment table somewhere else, or they're in the waiting room. If you're doing caregiver training in the person's home, because your business model is you see people in their homes as outpatient. Maybe you're doing caregiver training with a caregiver in the kitchen. The patient is in the family room. They're in the bedroom. They're just not present. Now, the key thing with these 3 CPT codes is you are teaching the caregiver or caregivers how to assist the patient with various tasks, whether teaching them how to assist them with communication, diet, feeding, bathing, dressing, self-care, bed mobility, transfers, gait. The key word is you are teaching the caregiver how to assist their loved one. Now, believe it or not, the Medicare program does reimburse for these 3 caregiver training services CPT codes. Because original Medicare reimburses, we actually see quite a few other payers, including some state Medicaid programs, also reimburse for these caregiver training services codes. And these codes really came about because of the pediatric population. Obviously there are therapists that treat pediatrics, and they were doing caregiver training to maybe the parent or the legal guardian, but the child was not present. Prior to 2024, there was no CPT code to charge, to bill for caregiver training without the patient present. We now have that. Now, under Medicare, if you bill any of these caregiver training services CPT codes to the Medicare program, the allowed amount for each CPT code does count towards the annual therapy dollar threshold. However, the multiple procedure payment reduction policy does not apply to these 3 codes. Also, an assistant can do the caregiver training under the direction and supervision of a therapist. To do the caregiver training services, you're doing that to a caregiver who is an adult and is who providing unpaid assistance to their loved one. So again, if this caregiver is being paid by, say, the state or being paid by the family, you cannot charge the caregiver training services CPT codes. It must be provided to an unpaid caregiver. Also, you must receive consent from either the patient or their legal guardian, their legal representative, to do the caregiver training to the caregiver. This consent can be obtained verbally, but you want to document that you did receive this consent in the patient's medical record. So for example, with pediatrics, obviously a child can't give consent. So the mom, in this example, could give consent to receive the caregiver training services. You would then document that the mom is giving consent for her to receive the caregiver training services. You would document that in the medical record. So again, these codes came out in 2024. The Medicare program pays for it. We are seeing some commercial and Medicaid programs pay for it. Also, as a country song goes, life's a dance. You learn as you go. You might have to find out by just billing it and then checking the EOBs, the ERAs, are you getting paid? And you also need to make sure that some of these commercial insurance carriers, Medicaid programs, also not counting when you bill the caregiver training services CPT codes, that they're not counting that as a visit towards the patient, allowed visit amount for therapy per that insurance plan, because it really is not a visit. The patient is not present. So, be sure to comment below. If you're using these codes, are you getting paid? If so, by which payers? So others can learn from you. To learn more about the caregiver training services, be sure to click the link below.